Hello, and welcome to our podcast series from the Greater Essex County District School Board. I'm Dr. Diane Zanier, and I'm here with Dr. Catharine Lee. We're both part of the board's psychology department. Today, we're going to talk about anxiety in children, and then we'll offer some specific information about anxiety and COVID-19.
Before we start, though, we wanted to let you know that if you believe that you or your child are experiencing emotional challenges, you shouldn't hesitate to contact one of the community supports that are listed on the board's website under the resource page supporting all of us through COVID-19.
We also wanted to say that the information from this podcast may need to be adjusted depending on your child's level of intellectual ability or maturity. Children's capacity for thinking and reasoning varies with age and experience, so understanding a child's needs and developing supports would need to be done keeping those factors in mind.
So let's start with the question of what is anxiety and how anxiety is different from fear. Fear is a normal reaction to temporary stressful situations, but anxiety is having fears or worries that are irrational or having a much higher than average number of fears or worries. Anxiety may stop children from engaging in daily activities. There are lots of different kinds of fears and worries, and the degree of fear can vary from mild to severe. Some fears are a part of normal development and typically pass as a child grows older, such as a fear of the dark for 2-year-olds or fear of thunderstorms for 6-year-olds. When fears develop, whether they are expected or not as a part of development, it's important to support the child.
That's right, Catherine. Another common question about anxiety is, what causes it? Anxiety is partly acquired through social learning. This means that we learn lots of things from parents and siblings and sometimes from our friends. For example, sometimes children acquire fears about illness or injury from older people. But anxiety is also due to a genetic predisposition, or what's referred to as temperament. In other words, some individuals are just more likely to experience anxiety than others.
So, what happens when a child expresses fear, such as a fear of peanuts? One thing the parent can do is to assist the child to differentiate whether the fear is dangerous or not. If it is, such as when a child has a peanut allergy, then the parent can help the child to create a safety plan. For example, the safety plan may be to not eat anything that a parent hasn't said is okay. If a child is afraid of catching COVID-19, then the parent can remind the child of good health practices. If the fear isn't dangerous, such as being afraid of all foods, even those foods the parent has said are okay, then it is anxiety. And the parent can reassure the child and help the child to be brave and face the anxiety.
Sometimes children have irrational fears about things that are make-believe. This is particularly true for younger children who sometimes struggle to differentiate what's real from what's pretend. For example, if a younger child becomes afraid of vampires after watching a Dracula film, then the parent can reassure the child that vampires are make-believe and encourage the child to engage in their usual activities.
Anxiety can also occur when thinking about something scary in the future, such as getting a needle at the doctor's office. When a child expresses anxiety about the future, a parent can offer concrete suggestions on how the child might manage the situation. Some children can participate themselves in this process by coming up with their own ideas, and the parent can help them to figure out if their ideas are realistic. For example, the parent can help the child to practice slowly breathing in and slowly breathing out, so the child is ready to focus on their breathing when the doctor is giving the injection. And the parent can remind the child that the injection only takes a few seconds.
Sometimes, though, parents may not know that their child is having scary thoughts. Listening and watching carefully, though, can give clues about what children might be thinking.
So what can parents do to help? Well, one thing parents can do is to model healthy ways of dealing with anxiety. It's okay for parents to admit they may have anxiety about something themselves, but then the parents need to show their children positive coping strategies. Parents can also share what worked and what didn't work, along with how they plan to do things better and differently in the future. This way, their child learns that failure is part of success, and success may require multiple attempts.
When coming up with ways to help, parents need to be mindful of being realistic. For example, if a child has a fear of tornadoes and there is a tornado warning, then it is appropriate to take cover until the warning has passed. But in the absence of bad weather, then the child should be encouraged to do what they're being asked to do. When children express fears, listen and be empathetic, and don't make promises you can't keep. A parent can't promise that a tornado will never harm their home. It's reasonable, though, to tell the child, "I know you're scared, but I will be close by and help you get through this." Being brave doesn't mean you don't have fear, but that you have the ability to overcome it. When a child is being brave, it's important for the parent to encourage that child and maintain emotional connectedness by not dismissing or ignoring their concerns.
Instead of trying to eliminate a child's anxiety, the parent's focus can be on helping the child to learn to manage that anxiety. Especially when a child is prone to experiencing anxiety, learning ways to deal with it can have long-lasting benefits. Not only that, but once a child learns strategies for one kind of anxiety, they might apply these strategies when coping with other fears and worries.
If a child is worrying about COVID-19, a parent can first make sure that they have accurate information to share about COVID-19 from credible and reliable sources. When a child asks questions, parents can listen to what they say and correct misinformation. Generally, explanations should be kept simple. Children may need help with figuring out whether their fears about COVID-19 are realistic. If a child asks whether someone they know will die, it's okay to say something like, "They're taking good care of themselves, and we hope not." Just a reminder here that such a response may not suit every situation, and how best to respond will depend on your child's intellectual ability and maturity. An older child might be able to handle more information than this.
Another thing parents can do is to be mindful of how much news about COVID-19 is being viewed. It is especially important to monitor children's exposure to the news, including the amount, the quality, and the quantity, and what it means to the child. Watching the news can be distressing for both children and adults, particularly when the content repeatedly contains negative details. Children and adults benefit from distractions, but distractions should be chosen carefully. Watching movies, for example, could help when the movie doesn't have the potential of causing new fears. Sometimes, after a while, watching movies can leave us feeling unproductive. Moments of fun can be balanced with moments that stimulate the mind or teach, such as with educational games. Engaging in activities that help out family or other community members while following social distancing guidelines can offer not only a distraction, but lead to feelings of being productive.
As a general rule, the younger children are, the more specific and concrete you'll need to be in talking and explaining things to them. It's usually a good idea to avoid long explanations with younger children or with children who have difficulty paying attention. Some children may only be able to pay attention for 15 minutes at a time, while some older children can pay attention for 45 minutes before taking a break.
Another general rule is to be patient and remember that all new things take time to learn. So if you come up with some useful ideas, remember that the child might need to practice many times before they can be successful independently. If your efforts are not working, the expectations may be beyond the child's capacity or understanding. If in doubt, seek support from a professional. Professional help may be warranted if a child shows behavior such as significant distress at being separated from a caregiver, significant changes in eating or drinking patterns, refusal to attend school or participate in extracurricular activities, or the child has significant changes in mood, sleeping, or other behaviors. Cognitive behavior therapy is effective in treating anxiety, especially for children older than 7 years of age. Please contact one of the community resources listed on the Supporting All of Us Through COVID-19 resource page for referral information.
We've included articles for you to read on this topic in the resources link of the Supporting All of Us Through COVID-19 page. For now, thank you for listening and stay safe.
Take good care.
Bye.